My name is Nick, and today I will be talking about why implantable cardioverter defibrillators are superior to standard defibrillators. First, we'll start off with the problem. In the USA, heart-related issues are among a growing concern for the population. Every year, about 335,000 Americans have a heart attack. Of these, 525,000 are a first heart attack. The scary thing, though, is that 210,000 of these happen to people who have already had a heart attack. With a range of treatments for potential life-saving devices, it is important to take a look and see which ones are better than others. For the 210,000 people that have previous history, the importance of finding a device to help them is very important. This is why we need defibrillators. Now we'll talk about the solution. Greater access to defibrillators could save about 40,000 lives each year. Specifically, we will talk about why the cardioverter defibrillators are the best option over standard defibrillators. You can see in the pictures here, the top left one is a standard defibrillator, which you would find on the wall in public areas and things of that nature. And then on the right, you will see the implantable defibrillator. First off, though, we need to establish the need for defibrillators. The intended use for defibrillators is for treatment when a person's heart stops from sudden cardiac arrest. The implementation of a defibrillator will be able to save a person's life by bringing the heart back into normal rhythm. The immediate cause of sudden cardiac arrest is usually due to an abnormality in your heart's rhythm, or arrhythmia, the result of a problem with your heart's electrical system. Unlike other muscles in your body, which rely on nerve connections to receive electrical stimulation which they need to function, your heart has its own electrical stimulator. So before we get into the implantable defibrillator, first we need to understand how the heart works. So like I said, the heart has its own electrical stimulator, and this is a specialized group of cells called the sinus node, which is located in the upper right chamber or right atrium of your heart. You can see that in the picture to the left there, the SA node. The sinus node generates electrical impulses that flow in an orderly manner through your heart to synchronize the heart rate and coordinate the pumping of blood from your heart to the rest of your body. If something goes wrong with the sinus node or the flow of electric impulses through your heart, an arrhythmia can result, causing your heart to beat too fast or too slow in an irregular fashion. Often these interruptions in rhythm are momentary and harmless, but some types of arrhythmia can be serious and lead to sudden stop in heart function or sudden cardiac arrest. Now, a person with a normal, healthy heart, a lasting irregular heart rhythm is not likely to develop without an outside trigger, such as an electric shock or the use of illegal drugs or trauma to the chest at the wrong time of the heart cycle. There are many heart conditions that can lead to sudden cardiac arrest, along with general aging and failure. The first that we will talk about is coronary artery disease. Right here in the picture to the right, you can see the picture of a normal artery, and then you can see the picture of a narrowing artery. What happens here is the arteries become clogged with cholesterol and other deposits, making it harder for the artery to conduct electrical impulses smoothly. Another problem is a heart attack. A heart attack triggers ventricular fibrillation, which is erratic electrical impulses which cause the ventricles of the heart to quiver uselessly instead of pumping blood. So basically they are not behaving like they should be, and no blood is pumping. From a heart attack, what can also happen is scar tissue can develop, which in the future will cause short circuits around that tissue, causing impulse problems, which is determining that number that we talked about earlier, the 210,000 people that suffer from a secondary heart attack. Another problem is an enlarged heart. Muscular walls stretch and enlarge or thicken which leads to tissue damage. And when the tissue gets damaged, there's problems sending the electrical signal, which can lead to a bad heart rhythm. One of the reasons, though, that the stretching or thickening of the heart muscle can happen is valvular heart disease, which basically means that the valves, the aortic valve basically, is leaking or narrowing so that the heart is overworking or is working too hard, basically, which causes the tissues to grow and deform, making it hard to pass signals properly. Another problem that could lead to this is congenital heart disease, which is basically a birth defect, and so basically it's passed down from a parent. Unfortunately, after these people have surgery to correct these issues, the patients still have a higher risk of heart-related issues. And then the last problem that we know about is general electrical issues caused by conditions such as Brugada syndrome and long QT syndrome. These both can lead to irregular abnormalities in the heart's rhythm, which can lead to heart failure. So let's talk about the best option. As we can see, it makes sense that the implantable cardioverter defibrillator is the best option, and this is because the defibrillator itself is always carried with the individual. It's not something that needs to be grabbed and set up and put on the patient when an issue's happened. As soon as something happens, this piece of equipment will go into action and save the person's life. You can see where it's located in the body. The defibrillator is placed into the body through a surgery, and it's most often placed in the chest area, just under the collarbone. The surgery involves making an incision below one of the collarbones, and then the leads will be placed into the heart through a vein that runs next to the collarbone. One lead will be placed in the ventricle, the bottom chamber, and one may be placed into the atrium, the top chamber, on the right side of the heart. So we'll quickly jump on this question here. What's the difference between a pacemaker and an implantable defibrillator? So, as you may know of both, they do have their similarities, especially the way that they look and where they're placed, but they do have different functions. The implantable cardioverter defibrillator is much different, actually. A pacemaker consists of a battery and a computerized generator and wires with the sensors as their tips. The sensors are called electrodes. The battery powers the generator, and both are surrounded by a thin metal box. The wires connect the generator to the heart, and the job of the pacemaker is to monitor and control the heartbeat. If your heart rhythm is abnormal, the computer will direct the generator to send electrical pulses to your heart. The pulses travel through the wires to reach your heart, and doctors monitor and adjust these on a regular basis. The implantable cardioverter defibrillator works very much like a pacemaker. However, the beauty of this piece of technology is that it can send low-energy shocks that reset abnormal heartbeats back to normal. It can also send a high-energy shock if an arrhythmia becomes so severe that the heart cannot pump at all. This is what makes the implantable cardioverter defibrillator a life-saving device, and why it is so much better than just a plain pacemaker. This technology takes the defibrillator's life-saving technology and allows the individual to carry it around with them, so that at a moment's notice it can be implemented to save their life. Now, some people will need the technology of both a pacemaker and a defibrillator to save their life, and now many new devices actually combine the technology of both into one unit, so people who need both functions have that. After the shock is delivered from the unit, a backup pacing mode is available on most models that may be needed for a short while to make sure that the heart falls back into its normal rhythm. Sometimes a heart doesn't even need to be fully shocked, and it just needs some small electrical adjustment in order to bring the heart back into normal function. The implantable cardioverter defibrillator has another type of treatment for certain fast heart rhythms called anti-tachycardia pacing, or ATP. This is a fast-pacing impulse sent to correct the rhythm, and this can be used instead of shocking the heart in some cases. The beauty of that is that it can be used to correct the problem but not deliver such a painful shock to the individual. So now we will talk about the specifics of the actual implantable cardioverter defibrillator. As you can see on the right there, this is a picture of an actual device. The implantable cardioverter defibrillator is powered by a battery and generates an electrical shock. It's also sometimes referred to as just a battery or a pulse generator. It's a single unit that is inserted, as we talked about earlier, right into the pectoral region. The longevity of this device is defined by the length of the life of the battery, normally 6 to 12 years. The leads of the device are flexible insulated wires that monitor the electrical impulses and report back the heart's electrical activity back to the implantable cardioverter defibrillator. These leads deliver charges from the generator to the heart when needed, as well as sending the signal back and forth. The way that this all works is that the defibrillator has a program basically that it follows to monitor the heart, and it makes decisions based off the frequencies that it's obtaining to make the certain adjustments that need to be made to the heart's rhythm. Now, once you have an implant, you have to live with the implant and have to make a few different lifestyle changes. Once an implantable cardioverter defibrillator is implemented into one's body, the individual must learn how to live with it. One of the most important aspects of living with the implantable cardioverter defibrillator is the monitoring. People with this defibrillator require monitoring throughout their lifetime, generally every 3 to 6 months. This device can be painlessly examined with a programmer that is placed on the area of the chest where the implantable defibrillator is located, and they have developed this technology to allow patients to actually even have evaluations from their home using internet services. So they'll scan themselves and it'll go right to the doctor. This is called remote monitoring. Information stored on the device can be reviewed to determine the remaining battery life and lead stability and function, program settings, and assess the pacing and shocks that it's provided over that period of time, and also obtaining data concerning the specific types of disturbances that it treated. And of course, like we said, it monitors the battery life, which is very important because premature failure issues can be very deadly. When it's time to replace it, it's very, very simple in retrospect. They still have to perform a surgery, but it's not as intensive as they just need to cut open the pouch where they put the first one in, and they remove the wires off of it and put a new, basically, battery pack into it and rehook up the same wires, so there's no new feeding of the leads through the veins into your heart. A few other things that you have to be careful of is there is driving restrictions that patients need to follow, as these electric shocks can obviously cause problems if you are driving. And then also there's a restriction of being in contact with electromagnetic interference. Since the technology basically works on proper sensing of the electrical activity of the heart, it's important to avoid the electromagnetic interference from external sources because it can confuse the defibrillator and may cause unwanted shock. So being such a wonderful product, obviously it's big business. The medical device field has seen tons of growth recently. There's actually been about a little over 5% growth from 2015 to 2020. And the Medtronic, the actual makers of a specific cardioverter defibrillator, showing that their sales are expected to grow from about 4.4% to $54.2 billion by 2020, which is astonishing.